What would you do if you won the lottery, like today? Would you pay off your student loans, buy a new car, buy a house? It's a thought that everyone has, but no one ever really thinks they'll win. Why is that? Because of the odds. What are the odds? The odds of winning the lottery in your lifetime are 1 in 100 million. You're actually more likely to get attacked by a shark than you are to win the lottery. Actually a lot more, because those odds are 1 in 3,748,067. Imagine that. Although those sound like really big numbers, it means that the chances of it happening are pretty small, right? Right. So, what are the odds of getting an STD? 1 in 4 teens will catch an STD. 1 in 2 people by the age of 25 will have contracted a disease at some point in their lifetime. So, technically speaking, that's me or you. Everyone knows about the common diseases, syphilis, gonorrhea, HPV, all those, but there are some we don't even know about or hear about on a daily basis. Have you ever heard of Lymphogranuloma venereum? No. It's also known as LGV. LGV is caused by the Chlamydia trachomatis bacteria. As an intracellular parasite, it infects its host by direct contact. Once inside the host, it lives on the mucosal membranes until it's able to enter the lymphatic system, travel to the lymph nodes, and reproduce inside of the macrophages. Once established inside of the macrophages and able to replicate, the bacteria causes a systematic disease that spreads throughout the body. This bacteria is not the same bacteria that causes genital chlamydia. Instead, it causes the 3 stages of LGV. The first stage including the primary lesion. This small bump occurs at the site of contact, so the penis, the vagina, or the rectum, or even in the mouth. This small bump can be very painless and go unnoticed extremely easily. It's small and it may or may not be filled with pus, but for women, it will usually occur inside their body, so inside of the genital tract, which makes it even more difficult to notice and treat. The second stage includes inguinal lymphadenopathy. Only occurring in 20 to 30% of females, this involves the swelling of the lymph nodes near the groin area. The swollen lymph nodes will either harden and resolve on their own, or they will swell and pop. Or they'll swell and still hurt and not pop, and you'll need to get them trained by a physician or sometimes even removed by surgery depending on severity. The last stage, which is the most severe stage, causes proctocolitis. Proctocolitis is more common in women because the first 2 stages usually go unnoticed. Therefore, there's no treatment that can resolve the issue before it gets so severe. Women, in this case, display symptoms later. Proctocolitis is also known as genitoanorectal syndrome. Symptoms of LGV include swollen lymph nodes that may drain pus around the groin area, painful bowel movements, small sores on the penis or vagina, and swelling and redness. LGV is diagnosed by biopsy of the lymph nodes or testing of the blood for the Chlamydia trachomatis bacteria. This STD is specifically hard to diagnose because it mimics a lot of other issues. Once diagnosed, LGV must be reported to the CDC, and it can be treated with antibiotics in about 21 days. Some complications of LGV include fistulas, encephalitis, eyes, joint, and liver infection, continued swelling and inflammation of the genitals, scarring and narrowing of the rectum, lymphatic obstruction, disfiguring ulceration. LGV is very uncommon in developed countries. LGV occurs more in Central and South America than North America, and also occurs more in men than women. Of the 350 cases reported annually in the US, the ratio of gay men with LGV to women is 5 to 1. Patients can be reinfected after treatment. LGV can be prevented by abstaining from sex or using latex barriers when engaging in sexual intercourse. This includes latex condoms or dental dams for oral sex. Also, limiting the number of partners reduces a person's risk for being exposed to STDs, like LGV. Regular STD testing and open communication with your partners is also very important. 20 million new cases of STDs are diagnosed in the United States annually. Of the 20 million, about half are young people between the ages of 15 and 24.